1 in 8 women in the U.S. will develop invasive breast cancer in their lifetime. That's about 12% of the women in the United States. Most people might think that those odds are pretty good, considering it's only 12% out of all the women in the U.S. But what if chances are that 1 in 8 women just so happens to be your mother, your grandmother, your sister, your aunt, your best friend, or even you? According to breastcancer.org, death rates due to breast cancer are higher than any other form of cancer besides lung cancer in U.S. women, and is most commonly diagnosed cancer among American women other than skin cancer. Today, I'm going to persuade you to take action in helping to lower the death rates of breast cancer by performing self-breast examinations and looking for early warning signs. Also, I'm going to ask for your help to raise awareness for this awful disease that too many women have already experienced or are currently experiencing. What is breast cancer? Whom does it affect? Treatment for breast cancer, and how we can help find a cure and raise awareness to lower the death rates of it. That's what I'm going to talk to you about today. There is a whole month out of the calendar year dedicated to breast cancer awareness. But what exactly is breast cancer? Breast cancer is a cancer that forms in the tissue of the breast. According to cancer.org, the most common type of cancer found in the breast is ductal carcinoma, which begins in the lining of the milk ducts. Another common type of cancer is lobular carcinoma, which begins in the lobules or milk glands of the breast. Earlier, I mentioned invasive breast cancer. This is cancer that has spread from where it began in the breast ducts or milk glands to surrounding normal tissues. It was estimated by the American Cancer Society that about 232,670 new cases of invasive breast cancer would be diagnosed in women this year. Although it is very rare, it is still possible that men can develop breast cancer as well. It was predicted that 2,360 cases of breast cancer would be diagnosed in men this year as well. Since there are numerous cases of breast cancer in the United States, it is only to be expected that there are multiple types of treatment options available for each patient depending on their case. Some of the main types of treatment for breast cancer include surgery, radiation therapy, chemotherapy, and hormone therapy. Most women with breast cancer have some type of surgery because it is often needed to remove a breast tumor. A woman can choose between two options when surgery is needed. These options include breast-conserving surgery, where only part of the breast containing the tumor is removed, or a mastectomy, which is removal of the entire breast. Radiation therapy is treatment with high-energy rays or particles that destroy cancer cells. Radiation treatment is usually given after breast-conserving surgery to help lower the chance of cancer coming back. Chemotherapy is a treatment with cancer-killing drugs. These drugs travel from the bloodstream to reach the cancer cells and can last for several months. Hormone therapy is often used to reduce the risk of cancer coming back after surgery, but it's also used to treat cancer that has come back after treatment or has spread. With today's medicine, there are multiple ways to treat breast cancer. Although there are so many treatments, there is still no cure, which still makes this disease so deadly. There is one way to help lower the death rate of this disease, and you don't have to be a doctor or a scientist to do it, and that's being informed and empowered. First, adult women of all ages are encouraged to perform breast self-exams at least once a month. Johns Hopkins Medical Center says 40% of diagnosed breast cancers are detected by women who feel a lump, so establishing a regular breast self-exam is very important. Becoming familiar with how your breasts look and feel can help you detect any changes early on, and you can alert your healthcare professional if need be. You can perform breast self-exams in the shower, in front of a mirror, or lying down. If you should find a lump, schedule an appointment with your doctor, but don't be alarmed. 8 out of 10 lumps found are not cancerous, according to the nationalbreastcancer.org. Raising awareness is also crucial in battling this disease. You can visit numerous breast cancer websites such as KomenLouisville.org to donate online or volunteer your time to help raise awareness. Susan G. Komen Louisville invests 75% of funds raised into local breast health services and dedicates the remaining 25% to research toward finding the cures. There are plenty of ways to join in the fight against cancer. Having breast cancer can be a scary thought. There are many different types of breast cancer that affect many different people with many different treatments. By performing self exams and helping raise awareness, you are helping to push the fight for a cure that much closer to a major turning point. I urge you to donate your time or money to one of these organizations that are fighting for women and men everywhere to find a cure. It might be someone you know one day that needs one of these organizations to fight for them.